Q&A as well. But just to share with you what is the ConcePTION app, how it works, how you could use it, and what are our plans for its launch. So first of all, why a ConcePTION app? Well, we know that in order to improve the collection for pregnancy and breastfeeding, we need to improve, first of all, the volume and the quality of information that we have in this situation. So we need to improve the status quo. So we learned how we can improve this as researchers, as scientists, but I think an equally important question would be how we can improve that if we are parents or if we are healthcare providers. So we know if you're a healthcare provider, you can report to the National Health Authority an adverse event, or you can report to the manufacturer if it happened in relation to a product. If you're a parent, you can report to your doctor, or you can report directly to the health authority or the manufacturer. What we are proposing is, we hope, something that is closer to the patient. So we are proposing the ConcePTION app. And in fact, what is it? What is the ConcePTION app? It, as the name says it, is an app to provide information, but also to collect information. So in addition to collecting adverse events related to pregnancy or to breastfeeding, what we are proposing is also to give something back. So to give back trusted information to the user, whether the user is a patient, whether the user is a healthcare provider. So how does it look like? Well, through the app, you will be able to report side effects and also exposures during pregnancy or breastfeeding. Depending on the country which you're in, you're going to be able to see the app and the questions in English or in the local language. First, we are going to launch in UK, so that the very first version of the app will be in English. But after that, our plan is to further expand so that everybody has access to it. In addition to reporting adverse events or exposures to pregnancy and breastfeeding, what you can also receive is a newsfeed. So I was saying before that we want to give something back as well. So to give back trusted information. So you're going to be able to select a medication list. So a few products that you're interested in, maybe you're under treatment with them, or maybe you're just interested to learn more about their safety during pregnancy or breastfeeding. And for these medications, you're going to be able to receive trusted information for their use in pregnancy and breastfeeding. How we have done so? So we have collaborated with and are collaborating with MHRA, and we are tailoring the MedSafety app. So MedSafety app is an app that is currently available for reporting adverse events. What we are doing is to tailor it to make it useful for pregnancy and breastfeeding exposures. So we are changing the questions, we are adding fields, we are adding features so that we have the right information to collect exposures and to collect additional information for these situations, for pregnancy and for breastfeeding. What is the general design? Well, it has two arms. First, we're going to develop on the spontaneous arm. So in this arm, everybody will be able to participate. So you're just going to download your app, then you're going to be able to report directly, and I'm going to show you how. And then in the second part of the project, we are going to focus on developing it for post-marketing data collection systems, such as a neurodevelopmental delay, longer-term follow-up. So in this arm, we are going to be able to add more features, more fields, so that we are able to send targeted follow-up questionnaires so that we collect more information targeted for a specific area. How does it look like? Pretty easy. It's user-friendly. So what you're going to see is the ConcePTION logo. So you're going to go in the store, App Store, and you're going to see the ConcePTION logo. So the green logo that you see on the left. Then you're going to be able to select your affiliation. So depending on which country you're in, you're going to select the country, or maybe if you're in a study, in the second part of the project, you're going to be able to select the study. You log in, or you have the option to continue as guest, so it's not mandatory to log in. And then you're able already to either create a watch list and receive information for the medications you're interested in, or report a side effect or an exposure to a specific product during pregnancy. How do you report? Quite easy. So the questions will be tailored depending on whether you're a healthcare professional or maybe you don't have any medical background, so you'll have different questions depending on the type of background you have. And it will be standard things like details regarding the patient, what is the exposure, what is the adverse event. You don't have to worry about typing the name of medications because you're going to be able to select from a list, so that as you type, the list will come up. And the same for reactions. As you type, some list will come up using the Medra dictionary. You're going to be able to add more information, so you receive a few targeted questions as well. I was mentioning before that we don't want it to be just a collection system. So we want to give something back. We want to provide information because we recognize how important it is also to provide trusted sources for the users. So this is an example. If you're interested, for example, to receive information regarding azithromycin, this is a sample of how the information will be provided to you. You'll have the key message at the beginning and then more details regarding the product and its use during pregnancy and breastfeeding. Again, if you're a scientist, you're going to receive the information in a more detailed format rather than if you don't have any medical background. And for the information that you're going to receive, of course, we are going to provide the references. Because first we are launching in UK, you're going to receive the information from MHRA. So from a trusted source, this is going to be targeted for pregnancy and breastfeeding. And just to stress again, only if you're willing. So just a few details. I won't go through all of these in the interest of time, but something to mention. The price is the best. It's free to download the news. It will be available both for Android and iOS. English first, but I'm very keen to translate it and launch it further in other countries. It will work, something important, without internet connection, so you're able to fill in all the information offline. However, to submit, you'll need a Wi-Fi or mobile data to be able just to submit to the health authorities, to MHRA. In terms of our plans, the plan is to complete first launch, as I was saying, in UK, in English, by second quarter of 2022. And for this, I would really love to be able to maximize your inputs. So without going any further, I would like to jump directly into the questions because I would like to hear from you. What do you think?